All right.
Perfect.
Good afternoon, everyone. Thanks for making time today. Uh, we'll start off by doing two quick intros and then jumping into things. But for those of you who don't know me, Manny Palombi, I'm the healthcare practice lead here at Qualtrics. Been at Qualtrics for 5 years, and prior to that, I was at IBM. There we go. Larry, over to you.
Hi, everyone. I'm Larry Sylvestre, and I'm the Chief Strategy Officer at HealthHub Solutions. I've been with the organization for about 18 months, and I've been in the healthcare industry for a long, long time. Got a few scars to show for it, but it's been a fantastic journey and really excited to be with you here today as Qualtrics and HealthHub are going to present to you how we can demonstrate some value for collecting patient feedback and the patient assessments at the point of care. And I think for the HealthHub customers who may not be familiar with Qualtrics, I'm going to pass it over to Manny in a moment, and then he'll give you an overview of Qualtrics. And what we'll do subsequent to that was give you a quick overview of HealthHub and what the offerings are that we provide, and then a short demonstration of how the Qualtrics and HealthHub solutions come together. Then we'll open things for a Q&A. And with that, I'm going to pass it to Manny to give a brief overview of Qualtrics.
Yeah, that's perfect. Thanks very much, Larry.
Hello.
Hold on, I'll just put some people on mute.
Sure. And you just direct me when to stop advancing, Manny.
Yeah. So we'll leave it on this slide because I'll share my scene in a second. So to Larry's point, today's a thought leadership call. We got together, we were brainstorming, and we said, hey, this would be an interesting idea for us to share with all of you. So some of you are using the Qualtrics platform. Thank you for that. Some of you are using the HealthHub platform, and thank you for that as well. And for those of you using both platforms, that's where today we're going to come together and show you a little bit of the art of the possible. We're going to focus on the themes, the patient experience, the IP bedside tech, and how they come together, and really how they can help you continue to evolve your patient experience and patient safety initiatives for the future. So I'm going to take a few minutes to review the Qualtrics platform for those of you where it's new, and what we're doing here in Ontario and some of the other hospitals in different provinces. And then I'll put a link to this website in the chat so you can all take a look. But don't worry if you don't get it, I will put it in the email afterwards as well. So with that, let me share my screen. And yeah, I got this, Larry. So little bit about Qualtrics. You'll hear the term XM experience management. In today's context, we're going to talk about it from a patient experience point of view. So what we're going to show you is here in the top left, improving experience and service of care. There's approximately 100 hospitals leveraging Qualtrics for patient experience here in Ontario, and our example is going to focus here. There are some other hospitals using Qualtrics for employee experience, some using it for patient-reported outcome metrics. My peers in the States also using it from an ROI perspective or a cost perspective, and I know that's important to us here in Canada as well, but they have a slightly different model, as you know. And again, a little bit about Qualtrics. With us being a cloud-based platform, we can help you with your patient journeys anywhere in the cycle. Today, we're going to really be focusing on the patient or the post-care, so really around here. But again, keep in mind, as some of your projects expand, feel free to ask us questions. And for those of you who are newer to Qualtrics, I'm clicking here on the System of Action tab. There's really three themes that we'll be focusing on. Listen, in my case, how do I help you engage digitally with your patients? Could be email, could be QR codes, could be anonymous link, really in any way that they want, SMS to their phone. So you reach out with the patient experience survey of any type, whether it's emerge, maternity, etc. As you get the feedback, how do you understand that? How does the platform help you analyze the structured data? Yeah, on a scale of 1 to 10, how are we doing? How does it help you recognize those nurses who are doing a great job? So the unstructured data, the open text, anyone you'd like to recognize, and also collecting open text on things like, is there anything else we can help you with? So we have a whole analytics platform. And step 3, acting on that, getting those dashboards that reinforce where you're doing well and keep it up, and where there's areas to act on. And we also have a case management system. So we can save the Qualtrics questions for later. Want to give you that backstory. And of course, this is a big community here, so there's quite a few of you on. We'll connect you with some of your peers at any time. But with that, I'm going to pass it back to Larry, where he's going to show how you could potentially use the some of the surveys that you're running on the platform, on the HealthHub platform.
Thanks, Manny. I think you just have to stop sharing so I can take sharing back.
Yeah, there we go.
Awesome. And I'll share my screen. Back to our presentation. All right, thank you, Manny. So a quick overview of HealthHub. What you see on the screen is what we call an integrated bedside terminal, or IBT for short. We have about 7,000 of these in various hospitals across Canada, primarily found in inpatient units. The device has been procured by these organizations in order to enable the patient to have some entertainment and engagement while they're resting in the facility or recovering in the facility or otherwise. And the device has been configured with applications that are going to allow the patient to, again, entertain themselves. We'll see a little bit more about that, but it provides an opportunity for not only entertaining the patient, but engaging them with their clinical information. So we can provide applications like IMD that will give the patient some context around their clinical situation, and even provide them with a discharge summary custom tailored to your environment. They can email those summaries to home, for example. We can integrate other applications on the IBT, like meal ordering integration, so that if you've got a dietary solution in place, you can afford your patients the ability to customize their meal ordering at that instance. And we can also provide clinicians with access to other tools like your EMR, for example, if you wanted to review a quick chart with the patient or other sort of use cases, those are also capable. The context here is we really want to provide last mile connectivity for clinical applications that add value to the patient experience, and also to bring capabilities to the patient experience that'll allow them to have a better experience during their stay. The device is really an industrial hospital grade touchscreen terminal that's safe for all of the disinfectants and other sort of cleaning mechanisms that you might be using in the hospital. Simple, intuitive, patient-centric design. We'll see that in the demonstration. It's touch sensitive. It's touch input for the patient's convenience. And we really know the demographic of the patients that are going to be using these devices. So we've made the usability a high priority for us, as well as the visual presentation of all of the icons, et cetera, are large for the sight impaired or otherwise. We offer this as a managed service, so you can have a complete separate network for this. I'm not going to get technical here, but it can be a discrete environment from the rest of your hospital infrastructure if that's the way that you want to proceed. That's what most of our customers end up doing. But the biggest thing I want to get across is that as a managed service, we will support the platform from end to end, not be a burden on your IT departments or otherwise to have this implemented inside the environment. So that managed service is something that we find is very attractive for our customers, so that they can afford this capability, and it isn't a burden to the institution to manage it over the course of time. As I said before, the patient entertainment and connectivity is a good chunk of this, as is the patient engagement and clinical efficiency and cost savings that we can derive from including the clinical applications. So our professional services team can come and do a time of flight study to look at a specific use case, like meal ordering, for example, and look at how the dietitians are engaging with the patient population, and envision a new sort of capabilities by affording that type of discrete integration and technological capability for the patients to customize the meal ordering right at the point of care, and then give you what that cost benefit outcome would look like, so that you can have an informed decision about whether or not this type of a technology investment is best for you. So again, our professional services teams are more than willing and happy to come out and do those types of time of flight assessments for you, and look where that value can be unlocked. But the most important conversation for today is really around how these devices can act as a last mile support for collecting that patient feedback about the quality of their stay, concerns about their stay, the pros of their stay, obviously, and any other facets of that patient experience while they're in the walls of the hospital to help you and your organization measure the experience of the patient and report on that potentially, depending on whatever your requirements might be. With that, I'm just going to jump into a quick overview of the platform. A lot of windows, tabbing. So this is the this is what the IBT shows to a patient when they're in the bed. They can choose, again, as I said, from entertainment and connectivity. They can watch television. They can utilize a device as a phone, so they can actually call their family or friends, etc. Video calling is also a capability on here. So, during the pandemic, we developed a feature very rapidly to allow patients to be able to have a video call with their friends and family. They can have a Wi-Fi hotspot so they can enable another device, at their bed location, if that's within the realm of what you want them to be doing. Netflix, YouTube, all of these other things for entertainment. They can also educate themselves, as I said. We've got IMD as an application where they can be provided contextually relevant information for the condition that they currently have, and be provided with a discharge summary, etc., so that they and discharge planning, in essence, so that you can educate the patient in the bed and they can have this residual copy of that discharge plan that they can email to home or family members to have with them. And within the hospital stay, you can do other things like language line solutions or voice or other types of on-demand interpretation where you can have real-time translation with a video call with someone right on the phone, on the IBT, I should say, so that you can conduct that in that clinical setting right at the point of care. And the star of the show for today is Qualtrics, obviously. We have done an integration here where we can launch in a touch-sensitive input mechanism a simple survey from Qualtrics. So this is just a brief example. Manny, I don't know if you want to talk about any of the parameters that are on here as I click through them.
No, I think you've captured it. What we've done here is we've recreated a potential survey, right? Very similar to the ones that are being run. Of course, it will be tailored to you. It will have your branding. It will have your website. But what we wanted to show, to Larry's point, is how easily you can put that icon on that main page. So, and it says Qualtrics, we can have it say patient experience, or we want to hear from you. Like we would, again, tailor it so that it's obvious, or you could point it out. But it was a very quick and easy setup on Larry's part to get that part going. And then to Larry's point, the patients there running it through at their pace as they need. So really, we wanted to get that message across and show how that could be set up.
Yeah, and I think that the parameter here that may be of most interest to many is that you're collecting this information while the patient is still in the bed. You can do it iteratively or whatever schedule that might provide value to you. We have done this integration quite rapidly, and we can see a lot of different use cases where you might want to, say, target a specific unit or target a specific demographic or target specific audiences. And we'd love to explore how some of those capabilities could be brought to bear in a conversation with you.
Yeah, and the one thing I'll point out, I see a question coming in, and we'll answer that in a second, Larry. While today, like we're talking patient experience, really this could be any project that you want to run on the platform. So there are ways to approach it, and we'll brainstorm those with you. So why don't I start to read some of these out, Larry, and I'll either pass to you
Sure.
or to myself. So Cheryl had a question. What happens if your org has a quota on surveys? How would you manage this within HealthHub? So the quota would be managed on the Qualtrics side of the house. So I'm happy to show you how on a per project basis you can set up a quota, and then you can decide what's best for you and when and where to collect. And Cheryl or anyone, feel free to jump in if there's more to it or if I don't, really hit the mark with that. So Melissa. Oh, Cheryl, go ahead. I saw that you raised your hand.
Sorry, I was just wondering, so if I'm a patient in the bed and I go to fill out the survey and the quota's already been met, will it just tell me that I don't have access?
I'm thinking this through. Yeah, that's what would come up on their screen. Yes. So we'd want to think through some of that so we don't have that experience, or that you at least have a heads up and you can pull down the survey. There's some process items we'll think through, but yeah, if we just let it be, they would click the button and it would say, hey, we code a nicer message, but something like, we've met this, so stay tuned. And we would tailor it to meet your needs. Okay, Melissa, our OHA surveys are only in English and French, but if a patient knows they can use the web browser to translate to many others. If the survey is integrated to HealthHub, does it launch in a web page where there would be similar functionality for translation? I don't know. That's a good question. Larry, did you want to? The premise here is that on browser, if on their mobile device they have it set to another language, the Qualtrics platform will pick it up if the survey is programmed in that other language.
I would have to test that. I can't say for certain, but if that is a capability that you're finding on a telephone, then it's probably something that we can enable on the IBT, but we'd have to just confirm it. Yeah.
Melissa, my thought is what we would do in this case, probably to keep it simple, is have it set up so that the language drop down comes up. Because again, I want to keep it simple. There's no need to do extra programming on the HealthHub side. We would when it renders there, we would just make sure that the drop down is there, so it would be easy for the patients to see they can take it in another language. Nicole, Melissa, go ahead. You have a question. Are you on mute, Melissa?
Can you hear me now?
There we go. Yeah.
Okay, perfect. Sorry. Thanks, Manny. So what I was wondering though is for our Qualtrics surveys right now, even if they're only translated into English and French, if the user opens up that survey link into their Microsoft Edge or Google Chrome web browser, for example, that they have the language in the web browser set to Arabic, the survey text will translate to Arabic for them. So I'm just wondering in HealthHub if that can also happen.
I don't think that. So let's step back. If they're using Qualtrics alone, let's park it from HealthHub. If they are in a different browser, I'm not sure that it will auto-translate. I'd have to ask my own SC on that, because if in platform you only have 2 languages, those should be the only 2 choices. I can't talk to a browser doing that third part. I don't think that we're set up that way right now.
Okay, I'll double check that as well.
Okay, and we can take that offline, and I'm happy to bring on my solution engineer so we can play that around. Okay,
Yeah.
Nicole,
Well, I'll just add one thing to that, Manny, in that on the IBT itself, we use a derivative of the Chrome browser. So if there are some browser-centric capabilities that you're employing to do the translation, or that you've seen in those use cases, there may be an option for us to do it. And as I said before, just be something we'd have to validate and see the whole use case, make sure that it's going to be functional for everyone. Yeah,
absolutely. And this is a good question, so we'll pursue this further. Are the surveys available in multiple languages? So right now they are in English and French, but every hospital has the capability to translate in any language they want. It's in platform functionality. And I always recommend please have someone proficient in the language, double check. So I do have some hospitals who've translated it into 5 or more languages, but right now standard from the OHA at least are English and French. Sarah, I see a hand raised.
Yeah, thank you. So if it is translated into whatever other 5 or 10 languages, whatever we decide, when a patient pulls it up on the IBT, would it automatically kind of give them the options to select which language they want? Like that screen would tell them which language, or would they still have to go into the survey first and then navigate the language?
So based on what Larry said, yeah, they would click the link to start the survey. And we don't have it in this demo, but they would see a drop down right at the very top that will have them toggle into whatever language is available.
Okay. Yes, I'm just thinking that through from a user perspective as well. Maybe this is an opportunity that, that screen is also translated into other languages so that if they can't read or write English, but they are fluent in another language, they wouldn't be able to navigate to that screen where they could actually select the language that they understand.
Yeah, no, that's totally a fair comment. It's something we need to look into. If conversely, you send them the email the next day on the platform and their mobile device or their laptop is already set to the other language and something you've programmed, then the survey will come up in their language of choice.
Okay. All right.
Yeah, so there's a path there. Again, it's a bit of a process. We do need to think some of these items through, but the functionality is in platform.
Okay. Appreciate it. Thank you.
Yep, great question. Roseanne asked, is there a push notification to encourage patients to do the survey? So yeah, that's a great question. So let's step back. Right now, Roseanne, most hospitals are sending a push notification the next day. So once you're discharged from Emerge or wherever, the EMR tells Qualtrics, these were the people who were discharged yesterday, please send them a survey. But as Larry and I and the HealthHub team were brainstorming, some of the feedback I've received is maybe not everyone has an email, not everyone's digital savvy. So are there other ways to engage with our patients? And that's why we came up with this idea. So what you could do is engage this way and have them opt in and provide the info. If for whatever reason they don't have time, they're not in a state to answer it, you would still continue with the usual process and have the push notification come to Qualtrics the next day. So we work through process with you, but you can have right now push is the standard way, but you could have HealthHub and push as well.
So what I meant by that, thank you for, is, so sometimes some patients aren't necessarily clicking and seeing links. So, would it pop up and say, hey, fill out a patient satisfaction survey, so that, it prompts or encourages patients to do the survey? I personally believe that we should do surveys way before the patient leaves. Because, I still have the chance to change their perspective or change their care while they're in the hospital versus once they're home, it's really hard to change that perception. So I do believe that having it at the bedside is key, which brings in also, we don't want to double up on surveys as well too. So
Yeah. Roseanne, I love that prompting and solicitation of someone to do something. I mean, that alerting and notifications that you've got a survey pending and that we'd appreciate your feedback is something that we're very interested in collaborating with the customer on developing, because there's a lot of ways that you could accomplish that, and having the right amount of flexibility and the right amount of capability at the same time is something that we would love to explore further. But you're right on the money. I see it exactly the same way. You want to be able to alert someone that there is something pending for them to take action on, or just to make them aware of it. And I think that would improve utilization and benefits for everyone. So
thank you.
We're definitely
You can
agreed.
keep us in mind. We're always working with you guys.
Yeah, awesome. Thanks.
Next question is from Patrick. Can patient information be pushed to Qualtrics when a patient clicks the icon so that the survey responses are identifiable? So actually, Patrick, what's nice about this is when they click that icon, the rendering is it's bringing them to the Qualtrics platform. So in fact, you're collecting it at source. And we talked to Jennifer, our solution engineer. What we'll probably do in this case, by nature, these surveys will be anonymous, at least for phase one. So we would, for the project that we would put on the HealthHub one, we would allow the patients to opt in at this stage. So yes, you would be collecting it at source, you'd have that info, and this way you can cross-reference that, or the platform can make sure that they don't, if they filled it out, they don't get another prompt when they are discharged.
Yeah. The key here is to be able to triangulate the identification of the patient with the bed location. And that is something that we have to do for like a meal ordering use case. Like it's patient Jones who's in bed 1 on unit 3, and this is their meal ordering application that is complete with all of the constraints that they have around their dietary situation, etc. So that type of capability we have. What we have not explored yet is how we can activate that type of capability for integration with Qualtrics to do directed surveys or to, I guess, audit or record directed responses and to facilitate the type of use case that you're talking about. It's possible, I think, but we don't know what it means to get from here to there. So I don't have a confirmed answer from our side yet, but we would love to explore that as well.
Okay, next question's from Nicole. Is there a way to navigate the survey without the touch, i.e. a remote or another tool? Depending on the patient population, the touchscreen isn't always the easiest, especially when trying to complete a survey. Well, that's a new question. Yeah, thoughts, Larry?
We have, I mean, obviously our device is touchscreen. That's the input. But I know Qualtrics is available on any web-enabled device. And you can add a keyboard to our device if that is something that someone wanted to do for a specific use case, or if you had a specific unit that had, dexterity issues as a large proportion of their patient population. There's some mitigations that we could look at. I hope that answers the question.
Nicole, did we hit the mark on that one?
Thank you, that's great.
Okay, perfect. Cheryl's next. If you were using HealthHub, how would you ensure that the same patient doesn't get an email survey after they are discharged? The surveys are anonymous. Yeah, so Cheryl, I had touched on this. This is part of the process items we'd want to discuss with you because we are now introducing a new channel, if you will, or distribution mode that may or may not be tied out. I mean, at a high level, if they opt in and provide their info, then the XM directory and Qualtrics will capture that, and it won't be, they won't get an email the next day. They may still get an email the next day, but in your intro, you could say, hey, if you've taken this at the bedside already, you can ignore. So we'll probably want to change the communication at a high level, and I bring in Sue and Susmic to help brainstorm. Cheryl, I see you actually raised your hand. Go ahead.
I was just gonna say, I would think that because as the hospital, I'm not gonna know when a patient's filled out a survey. And so when we send the list to Qualtrics of our discharged patients, Qualtrics would then have to determine if they've already filled out a survey.
Yeah, so this is a process thing. It can be done in platform to some extent, but now we're getting into anonymous versus we'll call it focused or dedicated, right? So I would say my gut tells me this is not going to be a big inconvenience because, for the patient, wow, they got me at the bedside and they're reaching out again. I think we'll want to probably capture in the communication. You may have filled this out at the bedside. If so, you can ignore. But again, we'll work with the OHA team and your OHA team and yourselves, because this really does come down to a process and what's there. I have some hospitals who are only collecting anonymous. So again, this just enhances what they're doing. But we'll balance it out and tailor it to meet your needs. I thought I had seen another question or hand go up, but okay, went down. Next question from Sarah is the ability to increase font size or utilize screen reader capabilities in the IPTs to support accessibility needs.
Yes, to the font size, screen reader, I don't believe so. I'd have to double check with the team. It's something we've talked about, but I don't believe it's there yet. But definitely the screen size font can be changed.
Yeah, and we are accessible by nature. Like our platform's always tested. So yeah, we would configure it so that the font size would be appropriate as you guide us. Okay, Leanne, can the results be set up with the routing, i.e. poor survey response on medicine units sent to medicine and patient relations manager? So Leanne, yes. On one of the points I'd mentioned on the ACT side, the third pillar, that is something you would set up in Qualtrics. So yeah, anyone who scores less than a 5 or who says the word cold food, again, I'm making it up, right? All of those are triggers that can be set up in Qualtrics, and it can be routed to one or more people. And we'll walk through that with you. It is already in platform functionality, so you have this feature in the platform, and then you would configure it to align exactly to what you need, and it would all be done in real time. So as soon as that survey is done, that, if whatever the issue was, it would go to the medicine manager and the patient relations person in this case. Okay, so we went through all the questions in the chat, and these are all great questions. Thank you very much. Oh, new ones come up too. Great, Leanna. I wonder if the IPT surveys are better suited to measure initiatives or expectations. Did staff introduce themselves? Was shift change done at bedside? Did staff? Okay. Yeah. Again, this is the learning for all of us. And I will say that we're only limited by your imagination. So there's the OHA surveys, and you're running those, and they're smooth and they're great. And you might actually even say, forget it. That process is running. We're getting high response rates. At the bedside, we want to do exactly as you laid out, Leanne. We want to have a different set of questions. How was ABC? Yet it is fully in your control. It is very easy to set up that project. Once the project is done, you would simply give the link to Larry and team, and they would set that up. So yeah, by all means, we talked about the OHA approach because that is a standardized approach that we're following. But as I mentioned on one of the earlier lunch and learns a few weeks back, you can add any and all new projects. So if there's another piece of information that you want to pull at that certain time, certainly we could set up a project that has exactly the questions you want, and Larry and team would set that up, whichever place is best on the screen with those patients. So that's a great expansion of ideas.
Yeah, and correct me if I'm wrong, Manny, but I mean, I think each of these survey tools that you put together come with a discrete web link, right? And so for the audience, what that means for us is that when you've got a new process or a new survey, it's simply communicating with your HealthHub representative and say, I've got a new link that I want to put on all of the IBTs. And it does not take like 24 hours. It's really easy for our teams to do that and disseminate it out to all of them if it's just a simple link for an anonymous survey. The integrated stuff we'd have to talk about further, but yeah.
But you've captured it right, Larry.
Simple.
Like we call them projects. Every project comes then with its own unique link. And yeah, they would simply copy and paste that and send it to your team. So it is very straightforward for us to do and for you to enable.
Yep.
Okay, any other questions? Anything we didn't cover? All right, Patrick, can IBT links be location specific? Unit A gets survey. Okay. Larry, do you want to touch on this one?
Yeah, Patrick, it's very much the same situation as I talked about previously. Being able to triangulate the identity of the patient to a bed and then grouping their capabilities that we have for other use cases like meal ordering. We haven't explored it in depth with Qualtrics yet. I think that there's probably a positive outcome to those discussions, and if we've got a willing customer who wants to pursue it, but I can't confirm or deny what it is yet because we haven't tested it. But I think it's
Patrick,
possible.
we were talking to Jennifer again. That's the Qualtrics solution engineer who's done all the helped build a lot of this. So her belief was that as long as your platform will share that data, so if they have an open API or there's a way to share it into Qualtrics, then yeah, potentially we feel we could do this. We want to test that on the HealthHub side, but there are steps through it. This is why we thought, okay, the anonymous one's the easy one. This one here we'll brainstorm with one of you and run it in a demo or a test environment for all of us, but it seems plausible on the whole that we could do this. Okay, great, thanks, Patrick. Joy T, another use case to consider, the survey capability can use proactively to garner feedback before program design, redesign, adding new offerings. Again, yes, like it could be like, we want to hear from you. We're going to, introduce new food, introduce a new process, how we give you feedback to your family. So yeah, back to my point, limited by only by your imagination. So every project's unique, and really we're both here because we always kind of say, okay, park the Qualtrics, park the HealthHub. Like what is that organizational initiative you're trying to achieve? And if you say, hey, we're trying to really improve a few things, that's the perspective we want before we dive into the tech. So we do appreciate you guiding us from an org perspective. It'll help us also brainstorm some of the art of the possible.
Excellent
Okay,
questions so far, though. Like, I mean, people have obviously given this some thought. So it's very encouraging to see the amount of engagement.
yeah, I love the passion. Okay, so team, this wasn't meant to be an hour. Larry and I knew we'd be pretty quick because we already know the initiatives that you're running in your respective hospitals, either with me or with HealthHub or with both. But we thought, in light of all the work that you've done, this would be a good time to come together. And part of our messaging is that we are in a community. And so we talk to the partner community, and HealthHub is part of mine and I'm part of theirs. And so we wanted to share that. And again, as you kind of think ahead in the next 3, 6, 9, 12 months, Larry, yeah, perfect point. Interested in learning more, just send us an email. Reach out to us. We're happy to share stories. We're happy to connect you with any of your peers. And we really want to be here to enable you to provide the best service possible. And we're glad to be part of that journey with you. So I'm good on my end. Larry, you're all good on your end?
Yeah, no, thank you very much, everyone, for your attendance and participation. That was just fantastic to see those types of questions coming through. Very encouraging. Thank you so much, everyone.
Perfect. With that, I'll stop the meeting and I will send the recording out, and feel free to share it with your peers. Okay, everyone, have a good day.
Thank you. Bye-bye.